Lianna Hiley from Hawaii. Lianna is here in Vancouver doing maintenance treatments for her RSD. Lianna was here last year and had quite the reaction to hyperbarics, doing 65 hours. She started in a wheelchair and left walking. Dancing. And so, Lianna, why don't you tell us what brought you back to our clinic for maintenance treatments?
Well, it had been about 8 months. I'd been doing really, really well. I got my life back basically because I couldn't do anything before. I was just on the couch, flat on my back with my feet in the air. It had already progressed to both my legs, up to my knees, and was very, very painful. And I had a wheelchair, but it was very difficult to use because the bumps, just bumping, were painful. But after I left here, I could walk pretty well. I could cook, clean, got my life back, could drive again, which I hadn't been able to do for 5 months. So I could drive and do things again. Not 100%, but still, the pain was pretty much gone, basically. I had to be very, I still had to be balanced. Like I couldn't go out all day and run around or anything. I could do things for 15 minutes and, then rest for 15 minutes, do a few more things around the house for 15 minutes and things like that. And so I thought that it would be good to come get some more and maybe I could progress a little more. I had been, I had actually gotten out for about 2 hours at a time and stuff like that, which was great. But I was getting a little tingling, a little numbness back, and a little burning, very minute. But I was like, I want to be there and I want to get hyperbaric so I can, get past that again. And so that's why I came back.
Okay. So to date, here you have done an additional 38 hours as a maintenance program.
Yes.
With a little bit of a break in between.
Mm-hmm.
And why don't you tell us where you are right now with your RSD?
Well, I can spend the whole day out. We can go drive somewhere and I can walk around in stores and things like that. Once in a while I use my wheelchair if we go to Costco and I got to go way to the back or something like that. I use my wheelchair just as prevention better than cure. And I just am so thrilled to have my life back because before I couldn't do anything. And now I can walk and when I first got here I couldn't go up and down the stairs last year. Now I can just about run up and down the stairs, no problem. I can, do so many more things. And I can still drive now and I can do a lot of things so much better. And I just feel like I've basically got my life back. I came here to do maintenance. I end up re-injuring myself, tripping on a stool and wrenching my leg out. But being here helped me. Within a week I was better already, whereas if I wasn't here I know it would have taken me months to get past that. Yeah.
Okay, so you've had some very, very good success.
Yeah.
What have you combined with the hyperbarics?
I do acupressure therapy, which I know really, really helps me a lot. If I didn't have that, I think it might not be as fast, the healing, but with that I notice it gets everything activated. I also, before I came back here I was using my LED light almost every night, the green light. I haven't used that hardly at all since I've been back here. I used to have it with me day and night and whenever I got pain I'd use it. Haven't had to use it. I actually forgot about it. I'm on no medication. Before I came back I had started, like I said, got the burn and I was on this natural thing called Nerve Fix. I got to wean off of that and I'm not on any medication at all.
Great.
Yeah.
Excellent.
Wonderful.
Any closing comments?
I'm just so thrilled. I think that anyone should try hyperbaric at least, and come with a positive attitude and just think that this could benefit you. It's not like my doctors wanted to cut my sympathetic nervous system. They wanted to do nerve blocks and other things. And I just thought I wanted to try out something else before that. and they wanted me on like 5 or 6 medications, which I weaned off last year. I ended up just being on one gabapentin, weaned off of that very quickly, and I just find that it should be something that everyone should at least give a try. That they have RSD, they should try it, because it gives you your life back. Your pain subsides, and it's just wonderful.
Great. Thank you very much.
Because I couldn't do that before.
I know.
Yeah, let's go. Proceed slowly, though. I can't catch up to you with this camera.
Okay, watch this girl go. I couldn't go upstairs, and now I can bomb up and down like nothing.
Can you go 2 at a time? There you did.
And I can go down, which I couldn't do before at all. I'll just go halfway. I'm so happy.
Can you run up?
Oh, probably. I did it yesterday 2 or 3 times.
Okay, come down.
I usually just be balanced, but it's pretty good. Ta-da! I know she wanted me to do a brief thing about, okay, my name's Lianna. I came here last year in a wheelchair with RSD, very, very painful. Couldn't stand at all, not even for 2 minutes. Did hyperbaric oxygen, and now I'm walking, and I was doing very well. It took away a lot of my, probably 75% of my symptoms. I just can't say enough good about the hyperbaric treatment. It was really wonderful. The staff is really wonderful, and I really appreciate it. I'll never be 100% probably, but the hyperbaric gave me my life back. And I appreciate that, because it's just an amazing thing. And